Hello and welcome. Today, we're diving into the world of neurological disorders to explore a rare but devastating disease at Canavan disease. This genetic disorder primarily affects the brain and is particularly hard on young children. Join us as we unravel the complexities of Canavan disease, from its causes to its potential treatments. Canavan disease is caused by a defect in a gene called ASPA. This gene provides the instructions for making an enzyme called aspartosylase. Aspartosylase plays a critical role in the brain, specifically in the production and breakdown of M-acetyl aspartate, or Na. Canavan disease is inherited in an autosomal recessive pattern. This means that both parents must be carriers of the defective gene for their child to be affected. If both parents are carriers, there's a 25% chance with each pregnancy that the child will inherit the disease, 50% chance the child will be a carrier, and a 25% chance the child will be unaffected. At a cellular level, Canavan disease is characterized by a deficiency of the aspartosylase enzyme. This deficiency leads to a buildup of N-acetyl aspartate, or Na, in the brain. Na is normally involved in myelin production, which is the protective sheath around nerve fibers. The excess Na disrupts the formation of myelin, leading to a process called demyelination. This demyelination disrupts the normal function of brain cells, hindering nerve signal transmission and causing progressive neurological damage. The brain effectively becomes overloaded with NAA, essentially poisoning itself and preventing proper development and function. Canavan disease is a rare disorder, with a higher prevalence in certain populations, particularly among Ashkenazi Jews. While precise statistics can vary, it's estimated that approximately 1 in 6, 400 to 1 in 13, 500 individuals of Ashkenazi Jewish descent are affected. In the general population, Canavan disease is significantly less common. Carrier screening is available for individuals of Ashkenazi Jewish descent who are planning to have children, which can help determine the risk of passing on the gene. The signs and symptoms of Canavan disease typically appear in infancy, often within the first few months of life. These symptoms can vary in severity, but common indicators include developmental delays, such as difficulty with motor skills like rolling over or sitting up. Infants may also exhibit hypotonia, meaning decreased muscle tone, causing them to appear fluffy. Macrocephaly, or an abnormally large head size, is another characteristic sign. Irritability, feeding difficulties, and seizures can also occur. As the disease progresses, vision problems, including blindness, may develop. Diagnosing Canavan disease involves a combination of clinical evaluation and laboratory testing. A doctor will assess the infant's symptoms and perform a neurological examination. Blood and urine tests can reveal elevated levels of N-acetyl aspartate, or Na, which is a key indicator of the disease. Genetic testing can confirm the diagnosis by identifying mutations in the ASP gene. MRI scans of the brain can also show characteristic abnormalities, such as demyelination and the presence of excess NAA. While there aren't distinct subtypes of Canavan disease in the traditional sense, the disease presents on a spectrum of severity. Some individuals may experience a more rapid progression of symptoms, while others may have a slower decline. The severity of the disease often correlates with the specific mutations in the ASPA gene and the residual activity of the aspartosylase enzyme. Currently, there is no cure for Canavan disease. Treatment focuses on managing symptoms and providing supportive care to improve the child's quality of life. This may involve physical therapy to help maintain muscle strength and mobility, occupational therapy to assist with daily living skills, and speech therapy to address communication difficulties. Medications can be used to control seizures and manage irritability. Nutritional support, such as feeding tubes, may be necessary if the child has difficulty eating. Experimental treatments, such as gene therapy, are being explored, but are not yet widely available. Because Canavan disease is a genetic disorder, primary prevention focuses on carrier screening and genetic counseling. Individuals of Ashkenazi Jewish descent, or those with a family history of Canavan disease, are encouraged to undergo carrier testing before planning a family. If both parents are carriers, they can discuss their options with a genetic counselor, including preimplantation genetic diagnosis (PGD) during in vitro fertilization (IVF), or prenatal testing during pregnancy. The prognosis for Canavan disease is generally poor. Most children with Canavan disease do not survive beyond childhood, typically succumbing to the disease before the age of 10. However, the exact lifespan can vary depending on the severity of the disease and the effectiveness of supportive care. Research is ongoing to find new treatments, including gene therapy, that could potentially slow the progression of the disease or even offer a cure. These experimental therapies aim to correct the underlying genetic defect or replace the missing enzyme. While these advances offer hope, they are still in the early stages of development. Recent research has also focused on understanding the role of NAA in the brain and developing strategies to reduce its accumulation. While a cure remains elusive, scientists are working tirelessly to improve the lives of those affected by Canavan disease and to ultimately find a way to prevent or treat this devastating disorder.